Hello, everybody. I'm just going to share with you an update on the comparison between the Event 201, which was held in, I believe it was New York in October of last year, the pandemic exercise, and the the name of the disease that they called the virus, or the name of the disease that was used in this pandemic exercise was called CAPS, coronavirus acute pulmonary syndrome. Yes, coronavirus. And of course, now we have the real pandemic, COVID-19. So I'm going to share with you an update on the comparisons. I watched all the videos, about 5 hours worth of videos, and took notes, lots of notes. And I'm going to share with you the comparisons. Fully 75%, no, actually, I think it's, what is it over here now? 80% right here, this number, 80% of the predictions and the suggestions that were talked about in this pandemic exercise in October have now come true during the real pandemic. All right, let's go. Public-private partnerships. We have seen that. Compared risk posed by pandemic to the risk posed by climate change. That was a recent change because we really hadn't seen that until just recently, but now they're starting to do that. Novel coronavirus started in South America, but in the real world, or in the real pandemic, it started in China. It started in bats, spread to pigs, spread to humans in the pandemic exercise. Here it's now we're starting to think that it was actually in a lab instead of the food market. So I'm just going to change this here. Started in a lab. Nobody knows for sure yet, but that seems to be the top going theory. It can lead to severe pneumonia. Even people with mild symptoms can spread the virus. Reports from GNN, which was the Global News Network. That was what they called in these videos, they actually had like these kind of fake news reports about the virus and what was happening around the world. And the channel that they used was the GNN, or the Global News Network, as opposed to CNN, the crap news network, or whatever you want to call it. Communist News Network, whatever. But I thought it was interesting because they used the word global. More on that as we go along. More transmissible than SARS or MERS. Spreads rapidly in densely populated areas. Fatality rate of 7%. We're at about 6% right now. So I'm going to change this. Pretty close though, right? At least in terms of the number of, there's two different measures. There's one is fatalities divided by total cases, and the other one is fatalities divided by closed cases. Fatalities divided by total cases is 6%. Fatalities divided by closed cases is around, I think it's around 18% right now. Spreads rapidly via travel, transmitted through the air. Almost every country is affected. Could be worse than 1980 Spanish flu. Probably not. Anything in yellow has not yet come true. Could see 10 million cases from the first 3 months. No, that didn't happen. Financial markets down worldwide. Yep. Vaccine not available at first. Could take at least a year. Antiviral drug might be available, but not enough supply. Supply is running low for masks, gloves, other medical supplies. Use HIV antiviral for pandemic patients. They call it Extranavir, and the real one that they're studying and getting close to using is Remdesivir by Gilead Sciences. So yeah, over here you got Extranavir, over here you got Remdesivir. Isn't that interesting how they're so similar? Respirators in short supply. Tensions rise between countries in need and supplier countries. Transmission could occur in hospitals and schools. Need to pull back regulations on producing and testing drugs, which Trump did so that they can get something out on the market faster to help people, save lives, for crying out loud. Here it says, okay, same thing. Whole country quarantines and border closures. Low-income countries struggle to finance supplies, drugs, vaccines. Need to make sure companies producing vaccine are financed. Need to have centralized global and local command and control. Well, there's been more rumblings out of the WHO and the UN for more global command and control. So that's why I put that on here as being now coming true. United Nations fits the bill for global command and control, like I just said. Rich countries need to help poorer countries financially. Need to determine if the virus is still spreading through animals. We pretty much have determined that it's not, but I don't know, who knows? People start hoarding and freaking out. Oh, yes. Small numbers of cases in some countries due to lack of detection systems. Small number of cases in some countries due to just the lack of the virus spreading, but also, yes, due to lack of detection system is certainly another issue. Global body must decide allocation drugs and vaccines. We haven't heard that yet, but I wouldn't be surprised. China not making enough drugs for its own people at first. I guess you could say that, considering they, had all these people getting infected and didn't do anything about it at first. So I guess you could put that there. Urge countries to contribute more to the production of drugs. Global business community needs to combat anti-globalization rhetoric. There's a lot of anti-globalization rhetoric out there right now. That is for darn sure. Public communication should not be alarming, but truthful. Well, a lot of public communication we're getting here, at least in the United States, is incredibly alarming, whether it's justified or not. A lot of people are dying, a lot of people are getting infected, but also we're definitely way overplaying it. Need to combat conspiracy theories. Plenty of conspiracy theories out there for sure. Need to know who controls the medical supply chains. Yeah, that's true. I guess I'm gonna put this one over here as coming true, because we've been hearing a lot about that recently. All right, now the second video was about trade and travel. We're not gonna go over cases because that's all just, well, let's see here. In the simulated pandemic, there was 260,000 cases and 13,000 deaths in the first 3 weeks. In the real pandemic, there was 59,000 cases and 1,200, so 1,200 deaths in the first 3 weeks, so a lot less. So all the projections for this pandemic going forth are a lot less than the simulated pandemic, because it started out at a much lower level. 2 million cases, 100,000 deaths in the first 7 weeks. We've only had 126,000 cases and 4,600 deaths in the first 7 weeks. We aren't even at 4 months yet. Major impacts on trade and travel. Healthcare facilities overwhelmed in some states. People staying home. People refusing to go to work and work from home. Yep, people are refusing to go to work. Partly because of health reasons, partly because they're getting more money they're getting paid more to stay at home as opposed to go to work, thanks to the stimulus bill. Crazy. Just crazy. Ripple effect racing through the service sector. Absolutely. Consumer confidence falling dramatically. Manufacturers pulling back production. Consumer spending has plummeted, but staples are hoarded. Yep. Noise and confusion dominate. Travel advisories and bans. Travel and trade bans and fever screens not effective in stalling the virus. That is completely not what we're seeing now. So that's why it's still in yellow. We've seen pretty much the opposite. Travel and trade bans have been very effective. Travel and trade restrictions could reduce GDP by 4%. We're going to see a lot bigger drop than 4%. Let me tell you. It says here, travel and trade restrictions could reduce GDP by 10 to 20%. Severe global recession predicted. Yep. Risk of spreading virus versus risk of spreading economic damage. So there's the debate about that. Trade, well, not a debate, but the debate is, what should be more important. Trade is important for food and fuel supply chains, obviously. Trade and travel employees lose hours, wages, and jobs. Absolutely. Need to use social media to calm people down. I haven't really seen that. Like I said, social media is making things worse. Crucial to keep travel going. Widespread travel bans and cancellations. So what they said here is not what we are, they said it was crucial to keep travel and trade or travel going, but we have shut it down. So I guess you could say that this has not happened in the real pandemic. Let's see here. Can telecom system uphold with more people or hold up with more people working online? And if you've been on a Zoom call lately or any kind of webinar, you would say that that's not exactly going so well. Everybody is online. Everybody is on Zoom. Must determine essential versus non-essential trade and travel. Yep, we've done that. Public understanding of the situation is more important than the travel ban. Well, they're both important, so I just left it in yellow. Travel restrictions impact countries with no cases, not recommended. Obviously, that didn't happen. Risk of allowing cargo in from highly infected countries. Travel industry will be in big trouble under the travel ban and need bailouts. Absolutely, that's what we're seeing now. Need government incentive for travel companies to collectively organize and keep things moving. We haven't really seen that. Delusional to think the UN can organize global trade and travel. I haven't really heard anybody say that, so I left it in yellow. Need to protect and support healthcare workers overseas already dealing with other diseases. Governments need to be able to help their own citizens without losing sovereignty. People will choose not to travel despite no ban if cases or deaths get high enough. Well, that really didn't happen because people were still wanting to travel up until the ban went into effect. All kinds of restrictions on travel. So that's still in yellow. Big companies with deep and wide supply chains can consolidate trade channels. We haven't really seen that. Important for government to not make the problem worse regarding policy and communications. Trust in government is declining. Yep. All right. Finance video. 1 million cases, 73,000 deaths in the first 6 weeks, 95,000 cases and 3,300 deaths in the first 6 weeks in the real pandemic. 5 million cases and 350,000 deaths in the first 10 weeks, 935,000 cases, 47,000 deaths in the first 10 weeks in the real pandemic. 30 million cases, 3 million deaths in the first 18 weeks. We are not yet at 18 weeks, but it's not going to be that bad. Can't afford a heavy-handed response that suffocates the economy. That's exactly what's happening. Bans and restrictions can be more consequential than the virus itself. Yep, pretty close to that, if not already. A global economic slowdown also risks lives. Yep. Emergency funding reaches its limits. Haven't gotten there yet. Funds are best used to save jobs and industries. 11% decline in GDP after 1 year, 25% decline in GDP after 2 years. It's probably going to be a really big, bad decline in the second quarter, not so much of a decline in the third quarter, and possibly an increase in the fourth quarter. So this is probably not going to come true. Pandemic could cause huge loss of workers and customers. Yes. Closest parallel is Great Depression, but pandemic impact could be much worse and longer. I don't know if it's going to be worse and longer than the Great Depression. I'm starting to think that this is not going to be the case. So I'm going to put this in yellow. All right. A lot of needs, but not enough money from the World Bank and the IMF. We need more sources of funds. That's what both the World Bank and the IMF have been saying. Governments could collapse without funding. Risk of default on sovereign debt soars. Now here's an interesting one. Need to fund countries to stabilize governments. Yep, that's what we're looking at now. The UN is calling on all governments around the world to fund countries that don't have enough money. Need to fund companies responding to the pandemic. Need to fund companies and industries too big to fail. Country deficits rise. Need money from G20 countries. Shutdown of economy can lead to access can lead to less access to healthcare, exacerbating the crisis. Excuse me. Here's another interesting one. All these ones in blue I thought were notable. Need centralized effort for raising and distributing funds across the globe, and that's what the United Nations is asking for. Need to be on a war footing. Yep. Don't underestimate the power of entrepreneurship. It can help to diversify supply chains. Smaller businesses may not survive, obviously. Travel industry is too big to fail. That's what we're hearing, because their travel industry is asking for a bailout. And I think they're going to get one. Did they get one already? I can't remember. Banks need to stress test again for pandemic impacts. Big debate about what's more important, stopping the pandemic or supporting the economy. Obviously, that's a huge debate right now. The economy is affected by loss of labor supply due to death and illness. Concern about political instability and violence. Significant effort needed to maintain liquidity and major financial institutions and keep major financial institutions afloat. Here's another interesting one. UN calls for pandemic-related trust fund and asks for contributions. Again, like I said, these are things that were talked about in a pandemic simulation. Look at all the things that have come true. It's just incredible. Just incredible. And that makes you wonder. I mean, there's the whole phrase of plandemic is not exactly a misnomer when you see all the things that they talked about and all the things that are actually coming true. Gates Foundation says priority is to stop the pandemic over economic concerns. Absolutely true in the real pandemic. Investors need to understand the spread of epidemic and invest in efforts to mitigate it. Can't tie emergency funding to longer-term natural resource contracts. That's for, for foreign donations. It hasn't really come true. Need better systems to be able to detect and respond to epidemics. Absolutely. Challenge to replace workforce capacity with workers that may not be qualified. We haven't really seen that as being an issue. Global leaders contract the virus. Yep, we've seen that. Companies and countries all need to work together. Need to have accountability for money being distributed. All right, now we're on to the video about communications. 4.2 million cases, 240,000 deaths in the first 9 weeks. We saw 471,000 cases, 21,000 deaths in the first 9 weeks. So again, a lot less. 12 million cases, 1 million deaths in the first 13 weeks. We only saw 2.6 million cases, 184,000 deaths in the first 13 weeks. Fear of government capacity to respond and remain viable fuels investor worries. Violence against healthcare workers and minorities rises. Minorities in terms of Asians, I've heard a lot of reports about people not treating Asians well. And violence against healthcare workers, we're starting to see some of that. Some of these protests are wagging their fingers at healthcare workers and seeing a lot of posts online about, healthcare workers, negative posts about healthcare workers. So nurses, yeah, there was one story about some dude who went out and slashed a whole bunch of tires of cars owned by nurses. That was just absolutely disgusting. Limited internet shutdowns to quell pandemic. We haven't seen that yet. Hope to God we don't. Need to manage misinformation and disinformation could lead to fall of governments. Both trolls and political leaders are spreading bad information. Another interesting thing. Rumors healthcare workers are purposely spreading the disease. I watched a video the other day talking about how they were concerned that that was actually happening. Pharma is being accused of introducing virus to profit from vaccines. Trust in pharma's wanes. Yeah, people are wondering about that. It's not a huge conspiracy theory, but there are people who are wondering about it. Unrest due to divisive messaging is rising. People stop cooperating with response efforts. Yep. Governments contradicting each other. Correct information is being outweighed by false information. Bans and restrictions on internet access lead to unrest. We haven't seen that yet and hope we don't. Approaches to limit social media for nefarious purposes have little success. We haven't seen that yet either. The public no longer knows who to trust, leading to a crisis of confidence. Absolutely. Public trusts their own employers the most. I don't know if that's true or not. I really don't know. So I'm leaving it at yellow. Tech needs to get a grip on their platforms of disinformation, and they have been, Facebook primarily has been blocking a lot of videos and content that they consider disinformation, but which may actually be true. Who knows? But for them to block it is just, that's really weighing on people's freedom of speech. They shouldn't be doing that. They should not be doing that. It should not be up to Facebook to determine what's true and what's false. It should be up to people to watch these videos and read these comments and decide for themselves. Just because a video doesn't disagree with Facebook's viewpoint of the whole situation doesn't mean they should be taking it down. That's criminal. In my mind, that's criminal and absolutely unconstitutional. Now, they are a private company and they have a right to do whatever they want. Okay, but come on, man, that's just wrong. Shutting down internet and social media is not desirable or practical. No, it's not, and we haven't seen it yet. Algorithms created to sift out bad information by Facebook and other social media. The WHO needs to be the focal point for information. We haven't really seen the WHO come out and say that yet, but they're kind of hinting at it. Must quell conspiracy theories about wealth redistribution from wealthy to poor countries. We haven't, it's not that big of a story yet. It's either happening or going to happen soon, but it's not that big of a story, so I left it in yellow. But that's part of the whole deal here, is there is going to be some redistribution of wealth, I think. People try treatments that don't work. Person died trying chloroquine, and somebody else died because they inhaled or they swallowed some cleaning agents or some kind of disinfectant or something. What a moron. Rumors spread that the antiviral drugs are actually creating or spreading the virus, and we have heard some of those rumors. Patients can share what worked for them in getting better and surviving. Yep. Need centralized response around communications on data, facts, and key messages, and that's what the UN has been saying. We need to let people know that most people will survive. Yes, we need to know that. We need to let people know that most people will survive. A lot of people oppose to or don't trust vaccines, making matters worse. Governments under pressure to provide politically favorable news. Absolutely. Discrepancies between WHO messages and government messages hampers travel and hospitality. Behavior needs to be incentivized. Behavior needs to be incentivized. Boy, haven't we heard enough messages about that. Oh my goodness. Wash your hands. Use hand sanitizer. Wear a mask. Don't come within 6 feet of people. Blah, blah, blah. Massive government incentives. Survivors least likely to spread false information can help with sharing correct information. Yep. Bad actors are spreading rumors to profit from short selling. How about Bill Ackman? Bill Ackman came along and said, this is just, like Armageddon. And then what did he do? He shorted the market and he made $1 billion, a freaking $1 billion on one trade. If that doesn't piss you off, I don't know what will. Need enforcement actions against fake news. And that's what YouTube, Facebook, Twitter are all doing. The WHO and the UN are encouraged to challenge governments on false information but threaten sovereignty. I haven't really seen that yet. Now the epilogue video, 65 million deaths in the first 18 months in the simulated pandemic. We're not going to see that. Cases in nearly every country. Eventually, no country was able to control the spread of the virus. Well, you know what? I'm going to leave that. I'm going to leave that as yellow because there are a lot of countries around the world who aren't seeing nearly the impact that some of the countries like the United States and European countries are seeing. Economic impact was drastic Global GDP was down 11%, stocks down 20 to 40%. We're probably going to see both of those. We already have seen it for stocks. We'll see what happens with GDP. Everyone just hunkered down. Hunkered down. That's a phrase that we hadn't heard before until this pandemic. And they were talking about it in October. Travel, finance, service, manufacturing, healthcare, insurance are all deeply affected. Riots and protests. We haven't seen riots yet, but we have certainly seen protests. Martial law in some countries, we haven't really seen that yet. Several governments fell, we haven't seen that yet. Attempts to control misinformation became used to control dissent, we haven't really seen that yet. Economic impacts could last a decade, societal impacts could last even longer. Yeah, I'd say that's probably pretty true right now. Suggested real-world planning and prevention measures. Here we go. Social distancing, isolating the sick and vulnerable, and surveillance. We haven't seen surveillance yet, but look at that. Social distancing. Nobody anywhere on planet Earth ever heard of the term social distancing until late January 2020 when the pandemic hit. And they were talking about it in October. Just wow. They already had the vernacular and the verbiage that they wanted to use. They already had it in place. Then when the pandemic hit, they just rolled it out. Unbelievable. Companies should push for more support and funding to prepare for a pandemic. You know, we haven't really heard that yet. We haven't really heard companies saying we need more money to push for support for the pandemic. No, they're saying we need more money just to pay our people and keep the lights on. Companies can help in a pandemic, not just government, of course. Need to work with WHO to enhance stockpiles of medical supplies. Haven't really heard about that yet. Travel and trade need to be maintained, which didn't happen. Need more resources for drugs, vaccines, and detection measures. Reassess global financial institution support. Media companies should suppress misinformation. Public confidence can be restored once an antiviral or vaccine is available. You know, we haven't seen that yet, so I'm leaving it in yellow, but yeah, that's certainly going to be the case. Advocate for stronger global governance. Huge message that was, you know, a theme throughout this whole entire pandemic exercise. And now that's exactly what we're hearing. Would be good to use data to learn more about diseases, preventions, and solutions. Another interesting point. Important to not be seen as a health event, but a global crisis. That's what we're hearing from the UN and the WHO, of course, and from other bad actors. Need more training for healthcare industry. Community and faith-based leaders are very frustrated. Need to teach them about pandemics. Well, I don't know if we really need to teach them about pandemics so much as we just need to let them open up again. If people can go to Home Depot and Menards and you know, some of these other things that are opening up. Giant candy store in Minnesota just opened up. Why can't churches open up? At least, you know, 25% capacity or 10% capacity, whatever the case may be. Let them open up, let people sign up for, you know, when they can go back to church, you know, just to limit the number of people. It can be done. It can be done, but they are not allowing it. It's a joke. And discrimination, if you ask me. Difficult for healthcare to gain trust during an outbreak. Yep. Supply of physicians is an issue. Yep. That's why a whole bunch of people went to New York on a temporary basis to help out New York with all their patients. And then the governor comes along and says, oh, thanks for helping us out. Oh, by the way, you're going to pay New York taxes on the income you made while you were helping out New York. Fantastic. Just brilliant. Way to go, you jerk. Oh, probably not prepared for civil unrest. Is military ready? Okay, so they said that in the pandemic exercise. We aren't there yet, although some national guards have been deployed to, I think, California and a couple other places. But they were talking about it in the pandemic simulation. I don't think we're going to get there because I think things are starting to kind of plateau here, but they were talking about it in the simulation. There won't be much movement on these efforts. In other words, to, prepare for a pandemic and all the different things that they were talking about until a real pandemic hits your country. That was actually a quote in one of the videos. There won't be much movement on these efforts until a real pandemic hits your country. Can you believe that? 4 months before the real pandemic hit, they said that. It's dangerous for the public to think there will be a quick fix. I don't know, it's dangerous, but you have to have a fine line between truth and optimism. But if anybody has listened to my podcast recently, there's a guy out there named Michael Osterholm who is just the most pessimistic person on planet Earth. Don't listen to him. He is terrible. He'll make you think it's like the apocalypse. Need to change behaviors. Yep. Another one. Here's what I thought was one of the most interesting parts of the entire pandemic exercise. One of the women in the exercise said, politics could be a major, well, she didn't say this, but she said, can you imagine if a pandemic like this hit during an election year? She literally said that. And you want to know what the response was from the people in their exercise? They laughed. They laughed. January 2020, the first month of an election year, the real pandemic hits. Unbelievable. Agreeing on central leadership would be a challenge. Yep. And that's it. That's it. So like I said, I'm going to have to change this number a little bit, but roughly 80%. It was 186 predictions. 149 predictions, suggestions have come true. That's about 80%. So if you think that this was a pre-planned pandemic, this little video that I'm sharing here with you is quite a lot of evidence that it actually could be the case. Thanks for listening, everybody. I hope you've been informed about this pandemic and compared to the exercise in October. In, of all places, New York City. Enjoy the rest of your night.